Hello, welcome to my weekly update. This past week has been not too good. I'm still feeling really terrible. I am absolutely exhausted on levels I didn't know it was possible to be exhausted on. And I also can't seem to figure out the fluctuation from day to day. Like yesterday, I had a day where I felt a little bit better, and then this morning I wake up and I feel like I've been hit by a truck again. So I don't know what I'm doing different. I mean, I'm literally eating the same thing from day to day. I don't know. But today's been really tough. I am absolutely exhausted. As far as the update on everything else, the gabapentin taper is still going. It's going actually really well. Granted, I am having the side effects of problems falling asleep and maybe a little uptick in anxiety, but overall I really feel like my body and brain is thanking me for starting to come off of this drug. I'm down to 900 milligrams a day, and I'm breaking that into 3 separate doses, and it's like every time I step down, my brain is so much clearer and I can remember things better. I'm able to just work through problems faster, and it's just everything kind of flows a lot better. And it's the first time that I can tell that I feel comfortable in my own mind again, and that's after 20 years of really not feeling comfortable, not only in my own skin but also in my mind. So this is a big step, and I'm going to keep going with the taper. I'm decreasing like 25% once a week. And if I have to, I'll go slower than that, but I don't know that I'm going to need to go much slower than that, to be honest. Let's see what else. I cleaned up my diet. I'm eating an all whole foods diet. I cut down the amount of meat and increased the amount of dairy because as long as it's not aged, I've been craving it like crazy. And I think that I have either low calcium or something. My body probably needs something from the dairy. I even added kefir. This is the first time I've ever tried it. And I ordered a couple containers, and it's the plain kind, and I drank it, and I just was not expecting that taste. It's like drinking yogurt. I just wasn't expecting it, but I could tell that, just after a few servings, that it's what my GI tract needs right now. So I'm going to keep going with that and adhering to the whole foods diet because it seems to be really helping. As far as the CerebroPep for the nerve damage from Lyme disease, I'm up to now 4 capsules a day. That's 5 days on, 2 days off, and it's continuing to kind of clear up my mind and also help heal some of that nerve damage. I've noticed that I have had some more feeling come back. I can actually feel like during that car accident that I was in 2006, it ruptured one of my breast implants, and I didn't know until a few years ago when a doctor did an exam and said, yeah, you've got some scar tissue here, it's probably ruptured, and now it hurts. So yeah, what are you gonna do? But take the good with the bad, I suppose. And I've been kind of used to that kind of happening as I've used CerebroPep to regain feeling through certain parts of my body, particularly, actually the only side of my body is the left-hand side. And that's from the whiplash from, it damaged some of the peripheral nerves that came out. So anyway, but at least I have feeling back now, and things are starting to move along. It is starting to plateau, which is pretty typical. With my experience with CerebroPep, is that you'll have like the first few weeks in particular are like when all of the amazing stuff happens and you're like, oh wow, this is fixing, or this is healed, or I can do this again. And then after a while it kind of plateaus, and then you go through the rest of your cycle. But I'm getting to that point now. Let's see what else. There is a webinar coming up from ILADS. It's peptide therapy for tick-borne disease patients, and it's being held by Nafisa Parpia, and that will be on the 10th. I'm going to go ahead and drop a link down in the description, so if you are a Lyme patient and you are interested in peptide therapy for tick-borne disease, they will have some great pointers on there. But what else? The last thing I want to talk about this week is something that I am actually really excited about. So I have started applying for schools to go back to college and change my degree. With everything that I've been through in my life, And the whole reason behind doing this channel and all of the social media stuff is because I want to change the medical system. Because what happened to me and my family never should have happened. We should not be made to go bankrupt because you get cancer or you become disabled. Like the misdiagnosis and the way patients are treated, in particular within the mental health sphere, like it's not right. I feel things need to change, so I'm going to go back to school and get a degree to make that possible. So I've picked an institution out. I'm not going to share what it is yet because I don't want to jinx it, but just starting to fill out that application earlier this week, I could tell, like I could feel that it was the right thing for me to be doing, and that, you know, I'm going to devote the rest of my life to this cause. Anyway, I just thought I'd share that. I think that's it for this week. I'll see you next. Thank you. Bye.